Assalamualaikum and a very good evening, ladies and gentlemen. Welcome to TVS Dialog. This is the show where we invite leaders, experts, analysts, and industry players on board to discuss specific topics, mostly concerning members of the public, of course, and the general, and maybe us as well, from topics such as economics, social issues, politics, to even health, which we will be discussing today, Handy. I'm Yusuf Shukri.
And I'm Handy Gui. So on today's topic, we will be talking about the many health issues that comes with age, especially arthritis. And with that, knee replacement surgery has been a transformative solution for individuals suffering from knee pains and reduced mobility. However, a remarkable advancement in the field is taking the surgical experience to a whole new level.
That's right, Handy. And with the advancement of technology, I'm sure patients out there who are expecting to undergo a surgery, they want a less invasive kind of surgery. They want faster
painful
recovery time, a less painful recovery, and with the existence of a technology called the Robotic Surgical Assistant, or ROSA. It has actually changed the game for quite a bit. I was made to believe that ROSA has been around since 2020. Yeah, and touching more on arthritis, as Handy has mentioned just now, arthritis is one of the most common condition that globally, and in Malaysia, in fact, 1 in 3 people over the age of 55 suffer from osteoarthritis, and this is a form of arthritis which affects the knee. And that does not mean, however, people who are
under the age of 50,
they are not invulnerable or immortal from suffering from OA, osteoarthritis, because OA is caused by many factors, right?
Yeah. Okay, I'm gonna jump in on that. OA is actually, it depends on various factors, such as it can be your lifestyle, nutrition, your body weight, and even gender. And did you know women are more prone to suffering from OA as compared to men due to menopause? So for today's topic, we will be discussing the common causes of OA, the treatment, as well as the preventive measures, and more importantly, a new method that is less invasive and less painful, known as ROSA, Robotic Surgical Assistant.
And to introduce ROSA to our audience and to discuss what are the benefits of ROSA knee replacement, we compare it to the traditional surgical method. We have Dr. Lee Wu Guan, the consultant adult reconstructive orthopedic and sports surgeon from KPJ Kuching. Welcome, Dr. Lee.
Hi. Good
Thank you so much for joining us today.
Yes, thank you. Thank you so much for taking your time out from your busy schedule.
Probably he had a surgery before this.
Yeah.
He looks like he's wearing the scrubs.
Yeah, you dress for it.
Now, doctor, first things first, we want to actually know more about ROSA itself. Can you give us a brief overview about ROSA?
Okay. So ROSA stands for Robotic Orthopaedic Surgical Assistant, and is designed to make the workflow of total knee replacement as accurate as possible, can execute the plan of the surgeon so that we can get the best outcome of it. So the robots, we'll imagine the robots come with the hands, legs, and then doing the surgery, but it's not. The truth is a robotic arm. I'm the one who do the surgery, but the robotic arm will ensure that the instruments, the jigs are placed in the perfect alignment. So from eyeballing, we can do it right, and in an experienced surgeon's hand, probably you'll get 90% right, but the robot will get it 99% right.
Okay, so the precision.
That means it's right from first time and every time.
But with the assistant, the robot assists the doctor, not the doctor assists the robot. Now, how does a ROSA assisted surgery, especially in terms of knee replacement, differ from the conventional method of knee replacement surgery?
All right. So we have sort of went through the evolution of the total knee replacement from conventional surgery to computer navigation in 2000s, the last 20 years, and right now we are into the robotic age. And why there is such a transition? So the first question we have to ask ourselves, do we need computer or we need robot to navigate to get the good outcome? So the definite answer is yes. I've been doing total knee replacement from 1997. So 25 years of experience. But even the studies and all kind of things are showing us. So there are some flaws in the traditional method or conventional kind of total knee replacement. So that is from the outcome study, a big study published in the Journal of Clinical Orthopaedic Research, showing that using the conventional method, there are 19% of dissatisfaction
19
among the patients who underwent the total knee replacement, and this is worldwide data. So that means 1 in 5 of patients are somehow not so happy with the outcome. So if we critically analyze this poor outcome data, there are 3 main reasons of dissatisfaction. Number 1, from infection, and number 2, from the alignment, that means implant instability.
I see.
The implant is not so stable or loosening, causing instability or loosening. So infection is one issue that every hospital and surgeon have to address it, although we cannot escape from it. But the critical issue that we can address it to make it right every time is the alignment, which can lead to instability and also the loosening. So I think we go through the computer navigation age, and right now we move into robots. And one of the major issues is over the past few decades. So even up to the computer navigation age, we are based on mechanical axis. That means the surgeon is doing the realignment and cutting the bones according to the mechanical axis. So we cut 90 degrees perpendicular to the mechanical axis. So it's like a simple cookbook for every cases. So when you cut perpendicular to the bone, it may not be parallel to our joint line. So that right now there is a new concept called kinematic knee. Kinematic knee means you individualize the alignment of every patient to put it as close to the native knee as possible. So we try to not to change the joint line obliquity. That means to make it parallel to the joint of your ankle, to make the knee parallel to your ankle as much as possible. Because studies show that when you don't change the joint obliquity and make it your joint more parallel to the native knee, so that you get more power in the gait, in the walking cycle, where we call the gait of patient is more powerful.
Okay, doctor, can I touch a bit on the clinical benefits before you go any further? What are the primary clinical benefits of using ROSA in knee replacement surgery?
You mentioned precision.
Every patient, they want a good surgical outcome. That means they expect the surgery to be done, and they want them with minimal pain swift recovery, early return to work, and they want the implant that is long lasting, as long as possible. So ROSA addressed the issue of putting the knee as accurate as possible to the mechanical axis of the body. So with minimal deviation, at the same time, it also try to maintain the normal kinematics of your native knee. So when it put in accurately and into your native kinematics, that means it lessens the soft tissue tension. So not much of soft tissue tension as compared to the conventional method. So enhance, so the recovery is much faster and the pain is less. So by putting it in the correct alignment, so it ensures that the prosthesis can last many years.
So you would say that this improve patient outcomes and faster recovery times.
Yeah.
By how many percent? Like, is there a study on that?
Okay. When we talk about outcome of patients, so it's not that, just the surgical techniques alone is enough. So it's a combination of, the short-term outcome, the combination of the pain management, and the long-term outcome is also in combination with the designs of the implants. You can put it very accurately, but if your implants design does not accommodate this kinematic kind of alignment, that means it's not fully conform. So it also defeats the purpose. So you need the power of 3. We call it the power of 3. So the accuracy provided by robots like ROSA and the implants designed by the company that is kinematically acceptable, and also it got an implant that can last very long, and combination with the surgeon's experience and techniques to integrate all the 3 together.
All right, I believe we've briefly know what ROSA is all about and what are the clinical benefits that it can offer to aspiring patients, I would say, who are experiencing knee problems.
Pains or
We're going to talk more, of course, about what makes a patient suitable to undergo a ROSA assisted surgery, and of course many more right here on TVS Dialog. So make sure you stay tuned with us. See you in a bit.
Hello there and welcome back, and thank you for staying with us. For more insights into the ROSA technology, we have with us here Dr. Lee Woo Guan, the consultant adult reconstructive orthopedic and sports surgeon. Now, shall we move on to the next question?
Yeah, sure. But before the break, just now we were briefly introduced what ROSA is by Dr. Lee, and the benefits of it, how precise a surgery can be done by using ROSA. Yes. Now I want to ask Dr. Lee, conducting the surgery must require some kind of skills, some kind of eligibility. What are these criteria that the surgeon needs to fulfill first before they are able to conduct a surgery with ROSA?
Okay, so the first thing, the surgeon must be equipped with the knowledge about how to perform a total knee replacement. So for example, if we are doing kinematic knee replacement, that means we are a switch from the conventional method. Then you must adopt the techniques, and then you will have full understanding about techniques, and then you know how to execute it using ROSA. So that itself is a combination of experience, knowledge, and the techniques. So in terms of robotic surgery, for surgeon who have gone through the computer navigation age, that means he has been using computer navigation for some time, then it's not a big transition because basically it's a little switch between computer and robots, because both computer and robotic you need to do landmarking on your knee. So that is something extra for the doctors, because it's not just the surgical techniques, you need to give the correct data input. So what we call as garbage in, garbage out, if you key in the long landmarking, then of course the computer or robots could be confused as well. So that is something that the surgeon need to get familiar with.
So it's like a value added, especially for experienced surgeons when do they have to undergo
so you need some training on the sawbone, on the cadavers and so on, so that you get used to this technique. Like what I say, if you've gone through the navigation
the
training,
era.
So for robots is just like you just glide into it. So not a big issue at all. But you just need to get familiar to the workflow.
I see.
We've talked about the eligibility of the doctor, the surgeon themselves, but what about
the patient selection?
How is every patient, let's say for example, those with knee problems, are they all eligible to, or rather suitable to undergo surgery assisted by ROSA, or is there certain criteria they need to fulfill?
So that the more complex is the surgery, the more you need the assistance. For example, some people may have the bow, it's not bow-legged, it's the whole bone is already bowed. That means the whole femur bone or the tibia bone is crooked, it's not a straight bone. So we call a bow femur. So you got a bow femur, bow-leggedness that has been there congenitally. So to balance this kind of knee, to perform total knee replacement, and in this group of patients, is very difficult. Even in the best experienced surgeon, you need to do complex calculation and so on. So if you got robots, so the robotic surgery starts with the preoperative planning. That means before even the surgery starts, so we already taking some specific films. That means some specific X-rays, which will be sent to the Montreal Center of ROSA and is converted into a 3D models.
3D image.
So before even working into a operating room, so you already got all the data with you. You can go to the computer screen and then you look at it. This is the alignment, the axis is like that. What is the plan? The plan is already designed for the patient. So this is a little bit different from computer navigation. So it's kind of evolution. So with robotic, we stress on preoperative planning. We get the data right first, and then the surgeon is already preempt on this alignment and how to execute the plan. And the robots will ensure it's right. So about selection criteria is the same as how you select a patient for total knee replacement. So for osteoarthritis patient, normally we do on stage 4, that means it's bone on bone kind of situation. So it's also indicated in rheumatoid arthritis patient. So the inflammatory arthropathy patient where the joint is destructed, or some cases in osteonecrosis, that means the blood supply to the knee is affected. So it is also indicated, and also after injuries.
Only stage 4
arthritis.
Only stage 4 patients.
Stage 4 is mainly for osteoarthritis, degenerative bone-on-bone kind of situation.
Now, doctor, what are the contraindications or limitations to using ROSA in knee surgeries?
Okay, so like what we say, so you must come with a teamwork. So when you do a robotic surgery, you are controlling some part of it. So the robot should be handled by fully trained personnel. So the fully trained personnel, they are normally the representative from the company. Like in ROSA case, is from Zimmer. So you need your OT team, your nurses, your scrub tech from Zimmer, yourself, everybody. You have to work cohesively. That means everybody understand each other and understand about robots, so that you can get it function.
You mentioned about teamwork, right? The workflow of what does a typical ROSA assisted surgery look like? How does it start from the start to the end of the surgery?
Okay, so the typical workflow, it takes about 5 days to get the 3D model
5 days, okay.
generated, and then from there you can inform patient, and when the patient come for surgery, then you'll be sort of, the plan is already there to execute it, no? So when you have pre-planned surgery, the good thing is the data is already there. So intraoperatively, then you do like normal surgical exposure, but at the same time, your team, when I expose the patient, my team is moving the robot around to the optimal position. They place the camera at the right position so that the robot can get all the data from my input. Then we have to do landmarking. We put a tracker on the bones, on the femur and tibia, and then the trackers will send the information to the monitor. So you got live data. It's a real time. So it's a real time data overlapping with the data you get pre-operatively. So you always counter check both data. So the pre-operative data, whether it's the same as the intraoperative data. So there are 3 layers of security there. That means you got a live data, you got the pre-operative data, and you also got the surgeon's experience, the surgeon to ensure that these 2 data, they really
accurate.
Yeah, they're accurate. So the surgeon can actually terminate the robot if you think something is going wrong and not accurate. It's not like the robot will execute yourself. You have full control. So if you think the pre-operative data is more correct and there is some input error, you can also decide to use your pre-operative data. So there are many layers of security.
Doctor, just now you were talking about the 3D image, yeah? So we know that every knee is unique, just like fingerprint. So can you reveal if there is a top secret formula that ROSA uses to create personalized knee replacement plan for each patient?
Yes, so that is what we call as a kinematic knee replacement. So when the patient has a bow-legged, so in the conventional knee replacement, we'll cut it every time 90 degrees and perpendicular to mechanical axis, regardless how many degrees they got. But when you do that, so sometimes you can over-release the soft tissue part. So you ignore the soft tissue part, you overcorrect, and then it leads to instability, too much of laxity to the patient. So the patient may not be very happy, especially on getting up from low sitting or going up down staircases. So the kinematic alignment, that means when you plan the surgery, you plan to slightly undercorrect it. So you put it as close to the native knee. That means it got bow-legged, I will leave it with slight bow-legged, but yet is within 3 degrees of the mechanical axis. So if the patient come with a knock knee, that means we call a valgus knee. So I also maintain slight valgus and as close as to the mechanical axis as possible. from there we maintain the soft tissue envelope well. We do minimal release, and there less pain and more recovery. So every patient is a personalized knee, personalized alignment. So it's not one cookbook for every cases.
No.
Okay. Yeah, we would love to talk about more about ROSA and how it is currently, this technology is new, and I'm sure it's going to be developed further in the future.
Yes.
We're going to talk about that, but first we have to take a short break. We'll be back right here on TVS Dialog. TVS Dialog. Today we are discussing in depth about the treatment of OA, which stands for osteoarthritis.
Using ROSA technology.
Using the ROSA technology, it's a more advanced technology compared to the conventional method previously. And I'm sure we've discussed about the clinical benefits and how ROSA actually works. But before we go further into the discussion, I would like to share right here that there's a growing aging population globally, and the prevalence of a sedentary lifestyle, especially post-pandemic. You know, during the pandemic, people are staying indoors to avoid themselves from getting infected by the virus itself. And because of this stay-at-home culture, I would say, the incidence of orthopedic conditions, especially within the Asia-Pacific region, is only expected to rise. And globally, chronic pain such as orthopedic related diseases or conditions, 20% of the global population actually suffers with this. And now, Handy, I think we have quite more questions to ask Doctor regarding to.
Now we know that ROSA is like a navigator in the knee surgery journey. So Dr. Lee, can you describe an instance where its precision was instrumental in achieving an exceptional outcome for a patient?
Okay, like what I have mentioned just now, the more complex is the problem, the more ROSA is instrumental to get the alignment right. Because some of the things you cannot eyeball because you can't even see. For example, patient with already fractured femur. So he end up with some deformity there at the thigh. So all patient with severe bow-legged or severe knock knee. So all these kind of very, very difficult cases, it can get wrong in the most experienced hands. What more to those who just get into the knee replacement. So in that case, robot is like extra pair of eyes. So it analyze and then it tell you exactly where is the alignment, where you go for the cuts and to get it right from the first time. So that is very important.
Yes.
So the whole game starts with a pre-operative planning. So that means you don't want to go into an operative room
without being
unsure about what you are going to do. So with robotic surgery, right before you go into the room, you already can check with computer, is this alignment okay? Whatever, you can simulate it on your screen and check your balance.
Yeah. And so, doctor, can you share with us the insights into the patient's perception and if there is any notable differences in pain management or recovery for patients undergoing ROSA assisted surgeries?
Okay, so there is not much different in the protocol of management of pain management in the robotic or non-robotic. In fact, in many countries, the joint replacement has already evolved into a so-called even a daycare surgery. You can even do a daycare. So in fact, is how you manage the pain protocol. Many of our patients, they are getting up after 6 hours, and the next day they are already walking on crutch. So there's not much problem. So in a country where cost is the big concern, that means you want to discharge patient as soon as possible to minimize the
cost,
the
and
therefore
cost.
You try to set up everything at home. That means before surgery you already got pre-operative visit. So what are the requirements, all the painkillers, everything you are already prescribed and set for the patients. So as soon as they got some recovery after surgery, and then you take them through few steps of working, and then they can go home. So there are some strict criteria as outpatient total knee replacement. But generally, there is not much difference in the robotic or non-robotic patient. But robotic patient, because of minimum soft tissue release, the pain management is much more easier.
So I'm a bit curious. Previously, how knees were replaced is by using a metallic structure, I would say, and to replace the knees, right? But what's the material being used now as we move on to more advanced technology?
Okay, so we are still using the same material, but with more advanced technology. So just now I mentioned about power of 3. So that means the robot provide the accuracy. The surgeon make sure the alignment is correct, a kinematic kind of alignment, and make sure the executive plan is done accurately. But there is another important part to make the success of the surgery. That is the implants design. So we choose ROSA because persona medial congruent design is one of the best in the market. And studies show that the medial pivot knee has 95% patient satisfaction in 18 years. So that is a breakthrough study, because the traditional total knee replacement satisfactory outcome is around 81%, but a medial pivot knee got something like 97% of patient satisfaction rate. That is because of the specific designs of the implant. It allows the stability at the inner side of the knee. We call that a full conformity at the inner side of the knee. So the inner side of the knee acts like a ball and socket, while you're allowing some laxity on the outer side of the knee for the rollback mechanism. So the persona medial congruent design is the excellent design for this. So there are many players in the market who provide robotics. So the 4 big companies like the Mako from Stryker, ROSA from Zimmer, Vallis from Johnson & Johnson, and Smith & Nephew. So there are some company they have the strength in their software, but not so good in their implants. So implants also play an important role. So, and therefore, when we choose ROSA, we carefully analyze all these factors, because they are providing what the market have as the best combination. You got good software, you got the
good
implants. So that is the power of 3 that can ensure the good surgical outcome of the patient.
So, doctor, you were talking about the patient's satisfaction. What about is there any common misconceptions about ROSA technology, seeing as it's kind of new? And how do you help people understand its benefits?
And it's AI operated in some ways, although...
Okay, so it's more of software orientated. So the robotic technology is sort of still quite new in Malaysia, so it's getting commoner and commoner. So like in KL, Kuala Lumpur, I think there is already at least 6 hospitals doing that. So although we are the first in Borneo, but I think over the past 3 years globally, so this technology is getting more and more matured, and the spread of words of patients is already from all the medias. They learn about this, so they may not understand fully, but they know that robotic assistance is helpful.
Talking about AI technology, what I meant to say was, the more sophisticated the technology is, the more expensive it is. It applies to things like our phones.
Basically everything.
Basically everything that has technology.
Yes.
So how, in terms of costs itself, how is ROSA more cost effective compared to the conventional method, and then how accessible is it?
to a wider range
compared to the
patients?
conventional method?
So when the technology comes out, initially the cost will be more expensive, and with time you'll get cheaper and cheaper. So we all understand that. So when it get more and more popular and more people doing it, then you'll become cheaper and cheaper. So for right now, the cost effectiveness is interpreted in that way that ROSA or the robotic surgery, they provide more accuracy, and that will create less failure and less revision surgery. When a revision surgery is unavoided, whether in the past, now, or in the future. But then with availability of ROSA, so that kind of mechanical errors of soft tissue balancing errors can get to the minimum. So you save the cost from readmitting the patient and undergoing complicated surgery by providing the best outcome and best patient satisfaction.
As a whole, it's more cost effective compared to
So in terms of the real cost itself, then of course when it's getting commoner, then the cost will come
definitely
down by
go down
itself.
Accessibility wise, is this so far ROSA, is it accessible for all?
Yes, I think you'll get popular and you'll be accessible. One of the example is our hospital Besar Kuala Lumpur has been doing many robotic cases,
surgeries.
So you'll be accessible from the public hospital soon. So it takes time, but you'll get commoner. You'll definitely happen.
Okay. All right. We're gonna talk more about the development of ROSA in the future from this point on. Right after the break. Don't you go anywhere. Stick right here on TVS Dialog.
Hello there and welcome back, and we're still with Dr. Lee Woo Guan from KPJ Kuching on ROSA technology in aiding knee replacement surgeries. Now, from the conversation earlier, we know that ROSA technology is reshaping the landscape of knee replacement surgery, and with its precision, personalization, and patient-centered benefits. This does not only improve the outcomes, but also redefine what is possible for individuals living with the pain. Now, Dr. Lee, for the future developments of ROSA technology, how do you envision the role of robotics in orthopedic surgery evolving, especially in the context of knee replacements?
All right. So certainly the technology will get it more and more friendly to the surgeon and to the patients. For example, right now, we need to send the data to the Montreal Center, and then they generate a 3D model. So in very soon future, I think the AI can do that. Probably when we send the data, the robot can instantly produce a 3D model by itself instantly, for example. Or within an hour, the robot already generate a 3D model. So there will be more and more features coming. For example, right now the robotic arm will be holding the jig instruments, then I do the cutting.
Oh, okay.
So in the near future, so probably the robot is getting more sophisticated, then the robot will know, oh, this is the best alignment. So even with less experienced surgeon, the robot maybe can tell you that based on the thousands of data, because the artificial intelligence, machine learning, that means the robot learns. So the robots will tell you that this is based on my experience and my data, that this is the best alignment if you want to do a kinematic replacement like this. So the robot may guide you further, or robot can even perform the cut. Once everything the surgeon think is safe, and you press the robotic arm come in and do all the cut precisely at one go.
Maybe the robot will not be just an arm. Maybe it will be a full-bodied robot doing the surgery itself, you know.
It's possible.
Yeah, that's possible, right? But I have a question in regards to total knee replacement we're talking about today, right? After the patient had their surgery, would they feel the same way as before, the original knee? Especially now that we have this technology.
Okay, so the answer is, for total knee replacement, you won't feel exactly like the same as your knee. So it's a functional knee, highly functional knee, but it cannot be as close as your native knee. So that is what we call as forgotten joint score. So forgotten joint score means after the surgery, years later, you completely forgot that I had a surgery before. So the forgotten joint score for total hip replacement is 90 to 95%. That means people can 90 to 95% of recovery from total hip replacement is so swift that you completely forgot you get that surgery done. But for knee replacement, it's generally around 80%. So forgotten joint score for knee is not as good as hip. That's why we need to move it forward to get better results.
I see.
On that, yeah, doctor, what advancement or innovations do you anticipate in the future for robotic assisted surgeries?
In terms of?
In terms of like the advancement innovation, because just now you were talking about how it is not going to be the same and everything, but for future developments, because the role of robotics in orthopedic surgery.
Okay, in the orthopedic surgery, I think robots, of course, will move to other fields as well. Like, the robotic arm for spine surgery. Spine is also a very complicated problem. Sometimes you have to put the instruments at the correct place, following alignment. So there are computer navigation for spine. Of course, the computer navigation for robots will come out as well. So in other fields like trauma also. So for surgeons, we welcome it, because with robots, it reduces our exposure to radiation.
It reduces the risk of patients as well, right?
Yeah, because when we do the conventional method, then we need to use the image intensifier, which expose the surgeon to high dose of radiation.
I see. So, doctor, is there any ongoing research or clinical trials that related to ROSA that you find particularly promising?
Yes, certainly the short-term patient outcome, especially on the personalized alignment, has been satisfactory. So as I say, the robotic knee replacement is sort of evolved and getting the popularity during the pandemics. That means over the past 2 or 3 years. So the data is still being collecting. So the short-term outcome is only about 2 years. So there will be more and more data coming.
Before we actually wrap up the session, I mean, I think we still have more time for some more questions, but
Yeah.
I want to ask in regards to patients' testimonials. I'm sure you've conducted surgeries using ROSA over here in Kuching, KPJ Kuching. What's the response like? What's the feedback like from these patients?
So far, I think the outcome is amazing.
Mm-hmm.
So we have done a couple of patients, and we can see in one of the videos the patient was shooting. They were three of
Walking?
the patients who had done the both knee replacement. That means you do simultaneous bilateral knee replacement. And one of them day 5, another day 3, they are already walking without stick.
Oh.
So it's generally most of our knee replacement patients nowadays, they recover very well. That means the next day they are getting up, and within a week normally they can get rid of the stick, and normally they can drive after 2 or 3 weeks.
So how many patients have you had already using it?
So we all together, I think this month alone, month of
August,
we'll be doing around 10 patients.
10 patients, all right.
That means rehabilitation wise, right? I think we're doing it's better than the conventional.
Is there
knee
any
replacement.
difference?
Yeah.
The rehabilitation process.
Yeah, so rehabilitation wise, I think for the short term is about the same. Like what I say, nowadays with our multimodality pain management, our patient normally recover very fast. So they normally can do without stick within a week. So can drive within 2 to 3 weeks. So but robotic with minimal soft tissue release will enhance it even more.
Now you mentioned rehabilitation. The cost itself is it includes the cost is it's more cost effective compared to conventional method because of the rehabilitation process.
Because of the safety.
Okay.
So it put it into more accurate position and avoid reoperation, readmission, and complication. Reduce the complication itself is cost effective.
So would you say it's much more cost effective in that way, in that sense?
Yes.
Compared to conventional.
So of course, investing in technology involving cost. So performing the robotic surgery using the latest technology, there is certain addition to the cost. But if we interpret it in terms of avoiding complication, then it worth it. But in general, I think because the technology is new and the investment involved, generally using the robot itself will need, in Malaysia, I think it needs additional 10,000 of cost to use a robotic arm per case.
Right.
Thank you for the wonderful insights.
Wonderful insights, doctor. But it looks like our time is up. Thank you so much for sharing with us and taking your time out of your busy schedule to share with our audience as well on the ROSA technology.
I know that I have benefited from what Doctor has, what we had discussed right here on TVS Dialog, and I'm sure people watching right now have benefited as well. Those who have concerns with their knees or even
reduced
other,
mobility.
Yes, of course you can always come over to
KPJ Kuching
for free consultations.
Yeah, and probably you'll get Dr. Lee Guan yourself
to actually give some consultations regarding with your condition. All right. Thank you so much again, Dr. Lee, for being with us today.
Thank you.
I'm Yusuf Shukri.
I'm Handy Gui for TVS Dialog.
TVS, we inspire your world. Take care. Thank you for watching.